Hello, everyone. I hope you're doing well. So for my movement analysis project, as you can guess, I'm going to break down a baseball swing, and I'm going to break it down into 3 phases. So the first phase is going to be the stance phase. Second phase will be point of contact, which is here. And then the third phase will be the follow through, the finish. So let's get started. So for the first phase, which is the stance phase, working from bottom to top. You can't really see my feet, but we're gonna start at the ankle. At the ankle, my left foot, I'm left-handed, so this is all gonna be left-handed. My left foot is in dorsiflexion. It's in the floor, and the muscles that came to mind for me were the tibialis anterior and the extensor hallucis. The tibialis anterior originates at the lateral surface of the tibia and inserts the medial cuneiform and base of the metatarsal. And the extensor hallucis originates at the middle third of the middle surface of the fibula and inserts at the base of the distal phalanx of the big toe. And then for my right foot is in plantar flexion. My heel's up, kind of getting ready to lift off. And during plantar flexion, the gastrocnemius and plantaris are active. The gastrocnemius originates at the back of the femur and the patella, and inserts at the posterior surface of the calcaneus. And your plantaris originates at the inferolateral side of the femur and inserts at the posterior surface of the calcaneus. Moving up to the knees, both knees are in, there's a little bit of flexion, not much, but slight flexion. So the muscles that came to mind were the bicep femoris and the semitendinosus. The bicep femoris originates at the ischial tuberosity and inserts at the head of the fibula. And the semitendinosus originates at the medial surface of the tendon of the long head of the bicep femoris. And inserts at the medial condyle of the tibia. Then moving up to the next joint is the hips. So standing here, it's not much, but there's slight hip flexion. So muscles that assist in hip flexion are the iliacus and the psoas major. So the iliacus originates in the superior part of the iliac fossa and inserts at the lesser trochanter of the femur. The psoas major originates at the 12th thoracic vertebrae through the 4th lumbar vertebrae, and inserts at the lesser trochanter of the femur as well. Moving up next, we're going to go to shoulders. So when you're holding a bat, your shoulders are, you're up here holding the bat up here, so your shoulders are in flexion. There's slight flexion in the shoulders. And muscles that assist in that are the anterior deltoid and the pectoralis major. Your anterior delt originates at the superior surface of the anterolateral third of the clavicle, which is going to be around there. And inserts the upper third of the humerus, so it's going to insert somewhere over here. And the pectoralis major originates at the anterior surface of the medial half of the clavicle and anterior surface of the sternum. So these 2 points probably. And through here. It's going to originate through here and all along your sternum. And inserts along the crest of the greater tubercle of the humerus. Next, moving up to your elbows. So holding the bat up here, both elbows are obviously in flexion. And those 2 muscles, brachialis and the brachioradialis. Brachialis originates along the anterior surface of the distal half of the humerus and inserts along the coronoid process and tuberosity of the ulna. Your brachioradialis originates in the upper 2/3 of the supracondylar ridge of the humerus and inserts near the wrist, proximal to the styloid process of the radius. So, and then Moving next down the arm, going to your wrist. There's not much. I had to think about this one. There's not much, but just a slight amount of extension in your wrist extension. To get a hold of that, you have to kind of rotate your wrist in like that, or rotate your wrist out. So muscles that help with wrist extension are going to be your extensor carpi radialis longus and the extensor carpi radialis brevis. And the longest originates in the lateral supracondylar ridge of the humerus that inserts along the second metacarpal. And the extensor carpi radialis brevis originates at the lateral epicondyle of the humerus and inserts at the posterior aspect of the base of the third metacarpal bone. Moving to your fingers, obviously when you're holding a bat, your fingers are going to be flexed. So the muscles that help with finger flexion are going to be the flexor digitorum profundus and your flexor digitorum superficialis. And it originates at the profundus originates at the proximal half of the anterior surface of the ulna, so along there, and then inserts at the palmar surfaces of the distal phalanges of the digits of your 2 through 5 fingers. So it's going to be these fingers right here. Your superficialis originates at the medial epicondyle of the humerus and the medial part of the coronoid process, and originates at the sides of the middle phalanges of the digits 2 through 5 again. So those fingers right there. So moving on to the second phase, which is your point of contact just here. Obviously you can't see my feet. You can kind of see my left foot back here. So actually when you're here, so when you're at your stance phase in the first phase, this foot is in, so we're gonna start back at the feet. This foot is in plantar and this foot, my left foot, is in dorsiflexion. So when you go to point of contact, your feet actually switch. So same thing, just opposite. My right foot is gonna be in dorsiflexion. My left foot will be in plantar flexion. Obviously, same thing applies. Dorsiflexion, tibialis anterior. So my right tibialis anterior and my right extensor hallucis are working, and my left gastrocnemius and plantaris are working for my left foot to get me into plantar flexion and dorsiflexion. Moving up to the knees, your knees, you can see it, are still, there's not much flexion. I was thinking there's lots of flexion in your left, obviously for me, but I was thinking, I didn't know, I had to think about hitting for a second, but you don't extend your knee. So there's lots of flexion in both knees. And as we move up to the hips, your right hip is going to be in flexion still. So there's still a little bit of flexion there, but your left hip is actually in extension. And the muscles that help with extension are going to be your gluteus maximus and your adductor magnus. So your gluteus maximus originates at the latero-posterior surface of the sacrum and coccyx and inserts at the gluteal tuberosity of the femur. Your adductor magnus originates at the tuberosity of the ischium and inserts at the linea aspera and adductor tubercle of the femur. Okay, we're going to move up to the shoulders now. So when you get to the point of contact, both shoulders go from flexion to extension, bringing the bat out here. So both shoulders are in extension, I'm sorry. And muscles that help with extension are your latissimus dorsi and your teres major. Your lat originates at the spinous process of the T7 through T12, your iliac crest, and inferior of the third and fourth rib, and inserts at the intertubercle groove of the humerus. So it's gonna wrap around and actually insert through here. Your teres major originates on the posterior surface of the inferior angle of the scapula and inserts along the medial lip of the intertubercle sulcus of the humerus. So moving down to your elbows, X joint. So when you get to the point of contact, your right elbow is actually an extension, left elbow is an flexion. So you get here, so your left elbow inflection, right elbow and an extension pretty much. So left elbow flexion, obviously the same thing. Brachialis and brachioradialis are helping that, assist in that flexion. Elbow flexion, extension, pretty much is your triceps brachii is assisting in, obviously the tricep has three different heads, but it originates on the humerus and the scapula. Those heads originate along the humerus and different parts of the scapula and inserts along the common tendon of the ulna. So it's gonna insert down through here. And obviously moving to your wrists and fingers, you're still holding the bat. I'm not gonna let go of the bat unless you hit the ball, hopefully you do. But your wrists are still a little bit of extension, fingers are still in flexion. So we're gonna move on to the next phase, which is phase 3, the final phase. So when you get to your finish, your left foot, my left foot is still in plantar flexion. My right foot is still in dorsiflexion because I'm still planted. Heel still at the ground, everything's dorsiflect. My left foot is still plantar flexed. Pretty much the same going up to your knee. Still flexed in my left knee, still flexed in my right knee. Now, like, as for every hitter is different, but for me, just for simplicity of the video, there's still flexion. You don't want to throw yourself back, so there's not going to be extension in the knee because you don't want that knee flexed and moving your power backwards. You want to move it forwards. And once again, your right hip is still in flexion. Left hip is still in extension. So your left hip is an extension. That's your gluteus maximus and adductor magnus. The flexion of your right hip is going to be your iliacus and psoas major. Those two muscles, that muscle grip's still working very, very much to keep that in flexion, keep your balance and stability. So moving up from your hips to your shoulders, as you come through and you finish, both shoulders actually go back into a little bit of flexion. Excuse me. And so that goes back to your anterior delt and pectoralis major that originate along your delt originating along your humerus, or along your clavicle, inserting along your humerus. I apologize. And your pec originating along your clavicle and your sternum, inserting along your humerus. And so as we go back to, then we move down to our elbows. We move down and we get here, both elbows are actually going to be flexed again. So going back, that's your brachialis and your brachioradialis, originating at the anterior surface of the distal half of the humerus is your brachialis. It inserts along the coronoid process and tuberosity of the ulna. Your brachioradialis originates in the upper 2/3 of the supracondylar ridge of the humerus and inserts near the wrist, proximal to that styloid process. And same thing, once again, you're still, now people finish, when I used to hit, I used to finish both hands on the bat. So my hands were still in, they never really rotated like that. Didn't want to do that. So wrists stay the same, fingers stay the same, and that's pretty much it. That's the movement analysis project for me and a baseball swing. Thank you very much for watching.